All right, I have 5 after, so let's get started. So the care planning track, continuing series of more than 10 fire connectathons over at least 5 years. So always progressing and evolving into some of the most current questions and standards. So let's kick off today's discussion. So next slide, Karen. Introduction scenario. We'll talk in some detail about the track scenario, which focused around diabetes care management, and then look at some of the resources we have available for testing during the Connectathon. So next slide. Here is our team. So track leads are myself, Dave Carlson. I'm a solutions architect on the eCare Plan project. Also Emma Jones, who is Fire IG and all things expert on clinicians' use of fire and care planning. Also Gay Dolan, been actively working to support the terminology, working closely with Emma. Sean Muir, also working in the app development, Smart on Fire apps that we are developing to be a demonstration of and a test of the care planning implementation guide. Also track support provided by Karen and Savannah. So description, overall high level. This is hosted by the multiple chronic conditions or MCC eCare Plan project. That project is sponsored by the NIH, NIDDK, also close collaboration with the Agency in Healthcare Research and Quality, AHRQ. So this has been a long-standing effort of theirs of going on by more than 5 years to better understand and to provide better support for specifically patients with multiple chronic conditions and the care planning and coordination associated with that. So they are the sponsors of this work and have been leading this effort for some time. We'll continue testing of a care plan implementation guide. We did provide an overall walkthrough and overview of that draft fire implementation guide at the January meeting. We'll again provide a next update on that work. Still a work in progress. Also, as part of this project, developing 2 Smart on Fire apps, one targeting clinicians and one targeting clinicians or providers as part of the care team for patients with multiple chronic conditions, and a second Smart on Fire app, patient and caregiver. So we've combined that focus really to support both patients and caregivers for patients to actually participate in both understanding their care plan as well as a priority now and going forward, contributing into that shared care planning activity, and then many value sets associated with standardizing all the data elements needed for these care plans. So generally focused on fire-based care plans. We are not directly focused on implementing clinical practice guidelines. However, the intention is that the implementation guide, the value sets, and the approach being used for Smart on Fire apps is can be integrated. We have some examples of how it is being integrated with other work, providing recommendation-based guidelines in fire-based applications. We'll talk a bit more about that and some work on that during the Connectathon. But generally to create and share person-centered care plans that are not specific to one disease. That's a really cornerstone of the work by NIH and ARC in this case, is to very intentionally support patients with multiple chronic conditions and not treated as one disease at a time or disease-specific care. Next slide. Goals overall then is focus on goals. We had a lot of really productive discussion around that in the January Connectathon. continuing and expanding on that, and received a lot of very positive feedback and support from clinicians, patient advocates, and caregivers that we've been working with, that to better incorporate goals, especially patient expressed goals, as part of the shared decision-making and shared care planning, is a significant gap in current clinical practice, and something that we can make a significant contribution towards. So continue expanding on the use of the FHIR standards to support this shared goal-oriented care planning. So looking at how these goals can be in practice made both clinically useful and interoperable, looking at relationships. So it's not just a goal as a text expression, but the relationships the goal has to the conditions or other assessments that that goal is intended to address, as well as in our sample and our testing during this Connectathon, putting more emphasis on the relationship of the goal and observations that help evaluate the progress or lack of progress toward that goal target. So more on that coming up. Looking at clinical feasibility in general of where and how we can use terminology coded definition of the goal, but also allow for a free text goal, especially those expressed by patients and caregivers. And looking toward, as much as possible, toward creating measurable goals that are related specifically to especially link codes for lab vital signs or other measurable outcomes. And I think that's probably enough on this. So some ongoing evaluation. Okay, next slide. And so track goals, I think I've probably covered much of this in overview as well, but putting goals in the context of care planning. So not just a goal resource on its own, has it interrelate with other elements of care planning for the conditions or the observations or assessments that the goal addresses, as well as relationships with outcome measures. So it's really an ongoing part of the care management. Care planning is an ongoing process. Actually, this looks very similar to the slide we just talked about. So I think next slide then. Okay, so I think next, Emma, are you able to provide an overview, next couple of slides of the, especially the diabetes scenario?
Yeah, so thanks, Dave. By way of introduction, I'm Emma Jones, Director of Interoperability with EMI. I'm also one of the HL7 Patient Care Work Group co-chairs, and one of the projects out of Patient Care Work Group is the Care Plan Domain Analysis Model that we've been working on for some years now. And this project actually is a direct spin-off or a direct, it provides the means in which we're trying to implement based on that, using the domain analysis model as our guide. So this work, and what we try to do in patient care is we try to align all our efforts. So currently this exact scenario is also being used for the patient care work group clinician on FHIR track. And this is where clinicians get together and we talk about clinical workflow, clinical fit for purposes to make sure that the FHIR resources can provide the capability that are needed for clinical care and for workflow. So there's a link into the clinician on FHIR work, and that actually will be happening next Thursday, I believe. No, the week after Thursday. So if anybody's interested in participating in that work, please join us. Again, the same story, same scenario is being used on the clinician on FHIR. They're focusing on clinical queries, which is actually really important when it comes to care planning and goals. On our Connectathon page, the scenario is actually spelled out. And as Dave mentioned, we're trying to make sure we're tying goals with interventions and all the other things that to show the linkages with goals and conditions and the outcomes in order to be able to tell the full clinical picture. So this scenario is about diet, and the patient is a diabetic, and she's having some issues trying to maintain her blood sugar. She needs some diet education. She needs to be able to log her, count her carbs, and also to be and the provider is making sure that she can obtain at her hemoglobin A1C goals as well. There are a number of things we want to explore in this track. One of them is being able to capture notes when it comes in relationship to the goals. And today, the goals are explained, or what's happening with the patient is can be explained and shared. Can you go to the next slide, please, Karen? So in this scenario, we've identified various goals, how they're linked to the interventions and what their outcomes are. And also in the description, using text, there's some conversation on this work as to quantifying and qualitative goals. So we're going to be taking a look at some of that. And then also we need to, we want to tie the goals to the various interventions, whether the interventions are planned or the interventions have been completed, to see if the outcomes were met. So those are some of the things that we're going to be working on with this and in this track this time around. Next slide, please. And again, we're as to making sure that we're capturing notes adequately in relationship to goals. So physician identify goals and the descriptions that they put around their goals that are captured in the system, and how that information can be extracted, or where it's extracted within the resource, so that it can be shared. Next slide, Karen. So again, we're targeting notes on goals, all the concerns that are addressed by goals, barrier. There's some use of new introduction of extension to deal with barriers, so that hopefully we will have those extensions to use for this Connectathon. And then also goal-related interventions and how goals are related to other goals. And this is also used in an extension. This is the whole milestone versus target goals conversation that has been happening within patient care and HL7. Next slide. Got it. And this is our scenario colorful. We always have a colorful picture to show the linkages. We always want to make sure we keep the care planning pieces in context of the care plan. And that's what this slide is attempting to do. It tells the same story that is spelled out within the scenario, and then how those linkages come together. And then we hopefully will also have an example in GitHub with the data that will be used for testing. I think that's my last slide. Is that my last slide, Karen?
But yeah, how's your day going?
Yes, back to Dave.
Okay.
Good, thanks Emma. So Patricia Noel, this is a fictitious patient persona. It's been described, it's evolved from a number of different patients by various names, but for the past few years now. This has been defined within our NIH team from the clinical perspective of really characteristic of the concerns and issues that they want to better understand and better support through shared care planning. So Patricia Noel gives us a grounding. It's always often very helpful to have a persona to make these abstract data more meaningful in our minds and in our testing and our demonstration. So that's where Patricia comes in. So Patricia has multiple chronic conditions, cornerstone of our work of CKD, or chronic kidney disease, diabetes, congestive heart failure, chronic low back pain, and depression. And these conditions are selected quite specifically. First of all, it's common, unfortunately, for patients to have 3 or more chronic conditions, and this entire combination, as shown here, is definitely not an unusual case. These are combinations plus more that are unfortunately common in practice. So we need to better understand how to support patients with these situations. So also looking at social determinants. Just want to point out too, after we finish kind of an overall summary of our scenario and text data, then definitely have an open conversation. I know some of you on the call today have a particular interest in social determinants, so we can come back in as much detail as you like on how we can incorporate those scenarios to expand this out. But recognizing that that's an essential part of this scenario and of our care planning as well on social determinants or social risks. And 2 examples here are transportation or lack of transportation for Patricia to get to her appointments, as well as looking at food security and community support in that area. Also, a recent expansion looking at, this is the case. So Patricia has a daughter, Rose. Rose is her primary caregiver. That's also a really cornerstone of our project's work, is to specifically allow for and support smart on fire applications that allow a caregiver to review and contribute directly to Patricia's care planning process. So this provides a good, a very pointed persona that illustrates common cases that are a particular target to our NIH project team. So next slide. Just a few more points on that as well. Some of her challenges, so we're looking not only her clinical or personal situation, but some of her challenges are related to scheduling for appointments broadly in the social determinant, social risks. Also looking at, again, a very a point that our NIH team raises over and over again is that in our current situation, too often a patient is the one who receives multiple care plans, each from a specialist, each at a disease-specific care plan, and too often up to the patient to resolve duplications, contradictions, and try to sort out what they in fact should work on. So our focus really is to look at a comprehensive care plan that is not disease specific. So this illustrates, you know, a common concern among patients that they are stressed, they don't know which doctor to listen to or what they should actually be doing when there are conflicts or duplications. So I think that covers enough on this right now, but this provides our overall context for the sample data, the testing, and the use cases that we're developing. Next slide. So sample data. We have a number of different scenarios we've developed, but this is building and evolving on a set of sample data that was used in our January Connectathon. We've updated some of the dates, and in particular, for the diabetes scenario that Emma described, we are expanding on significantly the sample data associated with the goals, outcomes, and tracking of Patricia's care planning for diabetes. So we do have these all on GitHub, and we can go into more detail in discussion here. If you like, we will also review those during the Connectathon itself as we kind of get into some of the details. These are all JSON bundles by R4, and the bundles are divided into a number of different files that represent different aspects, but they're designed in a way that this entire set of data, quite comprehensive for a problem list, med list, care team members, some recent vital signs, observations, and then as well as the diabetes scenario specifically of the goals and relationships among those goals. All of those are in a set of JSON files that are have interrelationships, and they're designed in a way that they can be easily installed into different test servers, and not only ours, but we've loaded them and others have loaded them into other FHIR server test systems. So trying to design these as a reusable set of sample data that others can use and expand on as well. So it's a cornerstone of a lot of our testing. So next slide then is taking those sample data and others. We do have a FHIR sandbox. Some of you may be familiar with the Logica sandbox, been used for quite a number of years. There's another sandbox that has some additional updates and enhancements we're using called MELD. Provide a link if you want to look at it. You can create yourselves a free, no cost to create a FHIR R4 sandbox in a matter of minutes, and load data, ours or any other, into that sandbox, and also configure smart on FHIR applications. So we use it as a basis for much of our testing within our team, as well as during the Connectathon, as both a secure endpoint where we'll be demonstrating smart on FHIR compliant applications and testing those, as well as an open endpoint that makes it readily available for anyone to perform queries on that endpoint without having to have the secure connection. Also, in addition to our sandbox, one important aspect for our project is to look at the smart on FHIR apps we are developing and to test them as much as possible with other vendor systems or any other projects that are out there that are providing a FHIR endpoint. So any of you who have a system that contains doesn't necessarily have to have a complete comprehensive care plan, but some of the elements that we're describing here, the applications we are developing, happy to work with you to connect our applications to your sandbox as smart on FHIR apps. And so we are doing that actively in our testing, especially with Epic, because we're working as part of our project with pilot testing these applications at a healthcare system that's running Epic. So we do a lot of testing with their entirely open, freely available sandbox that they provide. We've done more preliminary, but still at least proof of concept testing against the similar FHIR R4 sandbox provided by Cerner, as well as also the FHIR R4 provided by VA for access to veteran data, very similar to the type of US core, US CDI support that Epic, Cerner, and other vendors are supporting. So we welcome anyone who has other endpoints, whether it's a vendor system or research project, anything else you'd like to explore in this similar way. But we will do some demonstration and testing during our Connectathon of working with Epic in particular. Next slide. So overall schedule. For those of you who participated in January, we had more detailed hour by hour. We followed suit of quite a few other tracks of providing some broader timeframes, especially to invite all of you to bring your applications or servers, your sample data to test on some of the scenarios that we're describing or other related scenarios. But we will start this off with an updated walkthrough of the MCC eCare Plan FHIR implementation guide, still a work in progress. Working through also, we started some overview of this in January. It was a great deal of interest around our use of the clinical quality language, or CQL, embedded within currently our patient caregiver facing application, where that CQL logic is used to classify and identify relationships between data elements in the care plan. So we'll spend more time walking through that, and a good opportunity for Q&A around how CQL can be used as an element of care planning related applications, or looking in the forward future to clinical decision support or other ways to build on this. Also been working with the Passio project as a track, US Core, their updates, implementation guides, gravity, social determinants. So kind of an open session we've allocated where we'll be welcoming others, especially related to these tracks, or others to look at cross-track synergies and interoperability testing. So day one, day two, looking more open testing, follow-up, going into more detail, looking at the smart and fire apps we're developing, or those that you may be bringing as well, but an open opportunity to roll up our sleeves and do some work. I think that that covers overall. Next slide, or I think that's about it here. Yeah, so the report out is required by HL7 for the Connectathon management. Each track must prepare a report out. There's a short summary at the end of day two, which we will be providing that overall to the group, but we absolutely invite all of you to contribute your own testing, screenshots, etc., into this to provide a good view of our overall Connectathon activities. And communication resources. Next slide. So I think register. I think registering for the care planning track is something that from the HL7 link to identify this track of interest. Doesn't limit which tracks you can or cannot participate in, but provides some planning support. We also have a Zulip thread dedicated for discussion within this track. That provides a link where you can find it also within Zulip. And in general, the HL7 process for HL7 Confluence site for the Connectathon page. And as we read in the beginning, the contact information of all of our track support leads. So I think that covers everything we had prepared here. Anything else you wanted to add, Karen or Savannah? From
Nope, that is it. Thank you, Dave.
So for those of you on the call, I see Ken, Michelle.
Yeah.